Hello, and welcome to the third TUH University Hospital podcast series of Let's Talk About. In this series, we are going to talk about Down syndrome. You will find this and our previous series on the hospital YouTube channel, Facebook page, Apple Podcasts, and Podbean. Each episode is targeted at individuals with Down syndrome, their families and carers, health and social care staff, and anybody who has an interest in the health needs of adults with Down syndrome in Ireland. We will speak with experts from Down Syndrome Ireland, Children's Health Ireland, the Intellectual Disability Supplement to the Irish Longitudinal Study on Ageing, known as IDS-TILDA, and our own expert speakers in intellectual disability and the National Intellectual Disability Memory Service in TUH University Hospital. Hello, my name is Geraldine Kyle and I'm a registered nurse tutor at TUH University Hospital and a mother of a young adult with Down syndrome. In this fourth episode of the Let's Talk About Down Syndrome podcast series, I'm delighted to welcome two of my colleagues from TUH University Hospital, Professor Seán Kennelly and Evelyn Reilly. Seán is a consultant geriatrician and is the clinical director of the National Intellectual Disability Memory Service. Evelyn is an advanced nurse practitioner in the National Intellectual Disability Memory Service. Welcome to both of you.
Thank you.
Thank you.
Seán, to start us off, could you tell us a little piece about the relationship between dementia and Down syndrome?
So there's a really close relationship, but probably the best place to start is to step back and say, what do we understand by dementia? So dementia is a term that we use that describes where, as a result of a memory or thinking problem, somebody has lost their ability to do their day-to-day functions as well as they would have done them beforehand. There's lots of different causes of dementia. So dementia in its own right isn't a diagnosis, but the most common cause of dementia is Alzheimer's disease. And that's the cause of dementia that's most linked to Down syndrome. And the reason why it's linked is because the trisomy 21, the extra chromosome 21, is also one of the chromosomes that codes for the production of a protein called amyloid, which is the main culprit protein that accumulates within the brain that causes Alzheimer's disease. And as a result, people who are living with Down syndrome have a much higher risk of developing Alzheimer's disease as they age, they develop it at a younger age than in the general population.
Okay. And how much younger would you expect to see it present in somebody with Down syndrome?
So in the general population, you may have only 5% of people at the age of 65 have Alzheimer's disease. In the Down syndrome population, that could be as high as 70% of people. We know that the usual age of onset is about 52 years of age for the development of signs and symptoms of dementia. But this protein actually can be accumulating for up to 10 years in advance of people developing these symptoms. So we have this long period of time where that protein is accumulating in the brain before we see the consequences of that accumulation, where they start to develop signs and symptoms such as memory loss. In people with dementia, we often see epilepsy as an early presentation feature. We can see changes in how they walk, changes in behaviour, which of course may go along with the onset of dementia. And the key thing is this is already happening in a complex background whereby somebody may have a lifelong intellectual disability where their walking, thinking and behaviours may already be a little bit out of kilter to the general population.
So the changes can sometimes be quite subtle, can't they? From what the baseline would have been. Perhaps.
Typically, it is subtle. If we see big changes quickly, oftentimes we're looking to see other reasons other than dementia. So oftentimes, we would get asked to see people in the National Intellectual Disability Memory Service whereby somebody has had an abrupt onset of symptoms. And that might be something like delirium, which is an acute confusional state that can happen as a result of medicine changes. It can happen as a result of constipation, which is very common in the population. And it can happen as a result of kidney infections, which are also quite common in the population. So we don't see a rapid change. The course of onset for somebody who's living with dementia is typically at least 2 years.
And Seán, one further question for you. What should our listeners be aware of when considering the risks of dementia in people with Down syndrome? Now, you've already identified some of the changes that might occur, but are there any particular behaviours that can be changed to reduce the risk of developing dementia for somebody with Down syndrome?
Well, one of the positive things over the last decade is this concept of brain health and understanding that there are things we can intervene with that actually give us the best opportunity for optimal brain health as we get older. When we look across the constellation of risk factors that, if you like, coincidentally also occur with Down syndrome, we see visual changes. So things like cataracts. So getting your cataracts addressed is very important. Hearing loss is also very common for people with Down syndrome. So making sure that any hearing loss is addressed is really important as well. Physical activity is probably the most important thing. Okay, so remaining active, exercising, not just, if you like, physical activity whereby we're mobilizing, but actually having a structured exercise program is really important. It gives best opportunity for brain health and reduces things like those cardiovascular risks that we also know can affect our brain health. And then there's subtle things like thyroid disorders, where often people can have an underactive thyroid that goes along with Down syndrome, making sure that that's addressed and that you're having your blood test every 6 months to make sure that your thyroid levels are correct. And there's another thing called obstructive sleep apnea, okay, which is a condition whereby, and particularly at night, if we hear people who are snoring or have what we call these apneic episodes where they're not breathing, and we know that's associated with the risk of developing Alzheimer's disease and dementia in later life. And there are easier, relatively straightforward interventions such as what we call continuous positive airway pressure masks that can address that and reduce down that risk, and also helps with other things. And monitoring to make sure that there's no evidence of any seizures. So, if we look at seizure incidence in people with Down syndrome, we see it in the first 2 years of life and then in the 6th decade of life. And that 6th decade of life is often associated with, it's often an early feature that somebody may be developing a memory or thinking problem. And we know that early treatment and better treatment of those seizures when they arise leads to a better kind of trajectory and a better lived experience for dementia.
Okay, that's so interesting. Thank you very much indeed. Evelyn, if I could move over to you, could you tell us a little piece about the memory service for individuals with intellectual disability here in Tala University Hospital?
Yes, of course. So the National ID Memory Service was established in 2020, not that long ago, to address the lack of opportunities for people with intellectual disability to access specialist memory clinics. The Irish National Dementia Strategy stressed some years ago that the need for systems, structures and indeed age-appropriate services to promote timely diagnosis for those experiencing early onset dementia needed to be addressed. And I suppose expectations for this very specialist service would include diagnostic services, rapid referrals, so we would fast track people who are urgent, case management, education for both families and service providers, appropriate post-diagnostic support, allied health, we would make referrals, as Professor Kennelly referred to. Research participation opportunities are hugely important, and clear communications with GPs and psychiatrists who make the referrals to us.
Okay.
This is Ireland's first national memory clinic, and we are a dedicated service where specially trained nursing staff working as advanced nurse practitioners, supported by an expert multidisciplinary team, promote timely diagnosis for those experiencing early onset dementia. We're ensuring that people with ID have equitable access to safe, timely, person-centred dementia assessment, diagnosis, treatment options, and of course post-diagnostic supports. We also deliver baseline screening for people with Down syndrome over the age of 35, and this enables us to measure change over time, which is very, very important.
Very good.
We use a battery of validated test instruments for diagnosing dementia in people with Down syndrome, as well as others with intellectual disabilities of other etiologies. And this allows us to measure change over time, as I said already, and indeed to differentiate decline due to dementia or other mental health issues from pre-existing impairment, with a particular emphasis that is placed on establishing change from their baseline. And that's why we really promote and insist that people with Down syndrome over the age of 35 should have that baseline screening done.
Absolutely.
Patients also attend for neuroimaging and full blood work, which, along with results from the neuropsychological assessments, are discussed by the team at our consensus case review. And this happens on a weekly basis and is led out by Professor Kennelly. We provide training for staff and services, as I said, supporting people with ID. We have developed a comprehensive referral and follow-up pathway, including dementia assessment, diagnosis and treatment, and post-diagnostic supports. In 2023, we saw over 419 patients in the clinic, and based on activities carried out in the clinic, this has led to better patient outcomes, better experiences of care, and a better supported staff, particularly for those staff in those big ID services. Going forward, we hope to grow the research network across and beyond Ireland to include research through the Clinical Trials Network and the Horizon 21 European Down Syndrome Consortium to support and grow dementia intervention studies for people with or at risk of developing dementia at an earlier age.
Oh, that is so interesting. And Evelyn, if any of our listeners were themselves a person with Down syndrome over the age of 35, or if they support somebody who fits that criteria, how do they get referred to your service, or how do they get input into the service that you run?
So we're accepting referrals from GPs, psychiatrists and psychologists at this point in time. So our referrals are coming in fast and steady.
Okay. And when you say national, so these would be referrals from all over the country, would that be correct?
Yes, we've referrals anywhere from Letterkenny to Cork to Tralee.
And, you know, we are hoping we will be speaking in a further episode with the lead investigator on IDS tilde, Professor Mary McCarran. And I suppose I'm interested to know, did that study really inform the work that you do, or was it structured in a particular way because of outcomes from that study?
Yeah, well, Professor McCarran did set up that study over 10 years ago. Wave 5 information was launched there more recently, but that has shown that people with Down syndrome who are at high risk of developing dementia have not got those opportunities to attend memory clinics. So this is one of the reasons why Tallaght took them up the mantle and have set up this national service at Tallaght University Hospital.
And so either one of you, is there a message that perhaps I haven't covered in my questions to you today that you think is important for our listeners to hear? Seán, I'll start with you. Was there anything further you'd like to add?
Yeah, so I think we're at a really exciting point from the point of view of how we diagnose and treat Alzheimer's disease. Within the general population, we have what we call the first disease-modifying therapies. These are therapies that will remove that protein amyloid that's the culprit as to what causes Alzheimer's disease. We don't yet have evidence as to how these medicines how effective they'll be in people with Down syndrome. But actually what it has started is this new realization that we can manage Alzheimer's disease as we do many other conditions. And this gives a very, very positive, if you like, outlook for people who are living with Down syndrome with regards to potential that we may be able to manage Alzheimer's disease. And this being the major life-limiting condition that people with Down syndrome live with now.
Okay, that's some very interesting times ahead. Thank you. And Evelyn, the same question to you. Is there anything that we didn't capture maybe in the questions earlier?
I think the key message that I would like to bring forward would be the importance of baseline screening. And again, capturing that group, the over 35 age group, and ensuring that they have opportunities for that baseline screening.
Yeah, and it'll be very interesting. The landscape of the future may look quite different in terms of how dementia affects people with Down syndrome. Thank you both so very much. So I'd like to say thank you to our contributors, Seán and Evelyn, this week. Thank you for listening. We discussed many resources during the course of the podcast that you might wish to access. We have set up a link on the Tallaght University Hospital website where you can read and learn more. In our next podcast, we will be joined by Professor Mary McCarran. Mary is a Professor of Ageing and Intellectual Disability, Director of the Trinity Centre for Ageing and Intellectual Disability, and Executive Director of the National Intellectual Disability Memory Service that we've just learned about today. We will hear about the origins of the IDS tilde study and how it has informed service provision for adults with Down syndrome.